Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Guess what we are going to be doing today? You don't need to guess, the title already tells you everything we are going to do today. Today we are going to be answering paper 1 May 2021 past question. May 2021 past question, paper 1. And we're going to be taking question 1, question 2, and question 3. And we're going to be explaining the marks allocated to each question and each point you give during the course of your exams. But before we go into details in today's class, if you are new on our YouTube channel, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we are going to be discussing May 2021 paper 1 past questions, and we are going to be doing it one after the other. So the first question on the booklet that particular day was this, which is: Mrs. Audu, a 35-year-old roadside trader, is admitted into the medical ward with complaints of general body weakness, scanty urine, nausea, vomiting, and anorexia, with blood pressure of 180/90 milligram mercury. A diagnosis of acute renal failure is made. Wow, how's this question like? They are already telling you already have the signs and symptoms. If you get to draw a care plan, you already have the signs and symptoms, and that is already giving you a clue to the nursing diagnosis. But let's go deep into the question proper to know if they asked us to draw a nursing care plan or not. The first question we have here is: define renal failure. Define what? Define renal failure. Like I will always tell my students, whenever you see failure, heart failure, cardiac failure, renal failure, this failure, it simply means what that particular organ used to carry out before, it does not used to carry it out for normally. The normal function of the kidney is no longer there as a result of the heart failure. So when you say renal failure, it simply means the inability of the kidney to carry out its normal function. And when the kidney is not carrying out its normal function, which is majorly filtration and removal of waste products, definitely there's going to be what? Increased nitrogenous waste, increased waste product generally in the bloodstream. And you know that is not good for our health. So that is what renal failure is all about. So when you are asked to talk about renal failure, you look at the mark attached to it. Looking at the mark attached to renal failure is just 2 marks. So you are expected to define 2-3 lines will give you your full points. This is not the time for you to be writing history. It's just what? 2 marks. So you can write 2-3 lines telling us that it is a sudden or severe reduction in previously normal renal function characterized by accumulation of nitrogenous waste products and the urine volume less than 400 ml to 600 ml per day. So in simple terms, it's simply the inability of the kidney to carry out its normal function, thereby resulting in increased nitrogenous waste and urine output of less than 400 ml per day. So the second question attached here is: enumerate 8 causes of acute renal failure. Looking at this question, they said enumerate. They didn't tell you how many you are to give. So what you are expected to do, they wrote 4 marks at the end of the question. That is to tell you are expected to give at least 8 causes of renal failure. You are not expected to give 1. You are not expected to give 4. Because at this particular point, each mark is half that will be attached. If you give 4, you'll be getting just 2 marks. Do we get now? So I'm going to be telling us the causes of renal failure. I'm using my phone. So we have a reduction in blood volume. For example, there's hemorrhage, bleeding. It simply means that the kidney will not be getting enough blood supply, and that can lead to what? Renal failure. There's hypertension. We all know that hypertension is the increase in the blood pressure. So hypertension can result in acute renal failure. That is why it is advisable for those that have hypertension should always check their blood pressure, regulate it, and take their proper medication. Then the other one I have is heart failure, liver failure, severe allergic reaction, severe burns, severe dehydration, cardiogenic shock, blood clots, glomerulonephritis, bladder cancer, cervical cancer, prostate cancer, kidney stone, obstruction along the urinary tract. All these are causes of what? Acute renal failure. Let me tell you a secret. When I was in the examination hall and I get something like this, anything that has to do with the kidney, that has effect on the kidney, I'll put it as one of the causes of renal failure. For example, glomerulonephritis is a disease condition of the kidney, and if not treated properly, it can disturb the normal function of the kidney, right? Then also, nephrotic syndrome is a problem of the kidney, and if not treated properly, it can result in acute renal failure. Urinary obstruction, dehydration, hemorrhage. You know the kidney requires blood to function, it requires oxygen. So if there's hemorrhage, the kidney will not be getting enough oxygen, will not be getting enough nutrient supply to function. So any organ that is affected in the body invariably affects the kidney, which is your liver failure, your heart failure, and all that. So take note of that. When they put 4 marks attached to a question, you give what? You give 8. I don't want to miss a point. That is why I am with my phone. Then the other says, discuss the nursing and medical management of Mrs. Awudu. You should discuss the nursing and medical management of Mrs. Awudu. Looking at this question now, they are not telling you to draw a nursing care plan. So this is not the time for you to draw a table, nursing diagnosis, this. They told you discuss the nursing and medical management of Mrs. Awudu. For those that have listened to watched our video and also listened to our audio on how to write nursing management with the acronym APO-DESERA, that will go a long way to help you understand how to write nursing management. So in such a situation, you are expected to apply the APO-DESERA format to get enough points. And the marks attached to this particular question is usually 9 marks. Sorry for the noise at the background. It's usually what? 9 marks attached to nursing management and nursing care plan. So if you understand APO-DESERA properly, you'll be able to apply it when it comes to acute renal failure. And also, your emphasis is going to be, first of all, you have to monitor the fluid intake and output. Anything relating to the kidney, anything relating to the bladder, anything related to the urinary tract at all, your main focus when it comes to assessment and also nursing care, you have to monitor the inputs and outputs of this patient to know if this person's kidney is actually functioning, is actually filtering the waste product out of the body. And you are still going to be talking about diet, because this patient is having anorexia, this patient is vomiting. Definitely this patient is going to be having imbalanced nutrition, less than body requirements. I don't know if you get now. So the points I have here, you have to assess, which is history taking. You have to assess the urine output. You have to assess the blood to know is blood coming out with the urine. You have to assess the blood. You have to carry out laboratory investigation. Proper urine analysis has to be taking place. And also, you have to assess the vital signs. That's why I said you have to watch the video on nursing management. We explain all this. You have to assess the skin, the face, and assess the level of consciousness. You have to monitor fluid and electrolyte balance. You have to try reduce the metabolic rate, reducing the metabolic rate. So what is encouraged at this moment is for the patient to rest. Remember, this patient is having general body weakness. So you have to encourage this patient to rest. Then if there is infection, there is fever, you have to tepid sponge the patient. Then promoting pulmonary function, this patient is assisted to turn. This patient might be very weak to even turn, might just be immobile on the bed, not be able to move properly. You have to also encourage patient to cough. Because of this immobility, the patient might just be there having so you have to stimulate the pulmonary function to actually work. You have to prevent infection. You have to provide skin care, like bathing the patient on bed, tepid sponging this patient. You have to do that. Then also, what do I have here? Nutritional therapy, replacement of dietary protein, giving caloric rich diets, food and fluid. Then you have to provide safety measure and forget about psychotherapy, because psychotherapy, it's very, very important when it comes to the management of a patient. Most patients, they usually get anxious as a result of even malaria, headache, not to talk of a patient having acute renal failure. The patient is already thinking, oh, how am I going to be coping with dialysis? How am I going to be coping with this? So psychotherapy is of paramount importance. So remember, the question says nursing management and medical management. So after applying your apodesera for the nursing management, the next thing online is your medical management. And when it comes to medical management, the first thing is intravenous infusion. You have to give fluid therapy to help this patient regain its fluid loss. Normally, it is usually 50% dextrose in 5% dextrose. It is usually given 8 hourly or as your doctor prescribed. That is also important. Corticosteroids can also be administered so that it will help with the immune response. Then also there are other drugs that can be administered, for example insulin and calcium replacement. This will help to actually move potassium back into the cells. Then diuretics are very, very important because they help to reduce edema. They help to remove excess fluid in the body. For example, your furosemide goes a long way to play. Then also antihypertensive. Remember, this patient is having BP of blood pressure of 180/90 milligram mercury. So antihypertensive medication such as nifedipine can also be prescribed, and you should administer it as prescribed by the doctor. Then most times when it comes to medical management, most students feel it's just drugs alone. You have to talk about the investigations that can be carried out. For example, full blood count, urine analysis, liver biopsy, renal function test. All these tests that are carried out to know how the kidney is functioning, it's very, very important to carry out in terms of medical management. Then also dialysis. We all know when we hear renal failure, the next thing that comes to our mind is dialysis, and you see a lot of patients spending on dialysis weekly, monthly. So dialysis is also one of the medical management for what? For acute renal failure. I hope that is clear. Then that takes us to the other question, which is outline the content of advice of Mrs. Awudu on discharge. Outline the content of advice for Mrs. Awudu on discharge. Let's leave acute renal failure alone. For example, a patient is going home. Won't you advise the patient, oh madam, take this medication as prescribed? The way I have prescribed it, the way doctor has prescribed it, you have to take this medication as prescribed. And also, even if you feel better, don't stop this medication. Keep taking it. Come for your regular checkup. If you notice anything abnormal, report to the facility. These are advice on discharge you can also give the patient. And also remember, we are talking about renal failure. So you have to talk to the patient. You have to advise the patient about regular fluid intake. Not just fluid, but clean water. This patient should continuously hydrate him or herself. Then also you have to talk about diet. Oh madam, you are going home. Ensure you take nutritious food and try as much as possible to reduce salt in your food, and also potassium rich diet. These are advice on discharge you have to give this patient. And you also have to emphasize on the importance of personal and environmental hygiene, because infection can go a long way to damage the kidney furthermore. So that is why you have to educate this patient on personal and environmental hygiene to prevent what? To prevent further infection that is likely going to what? Damage the kidney. Then that takes us to the other question, which says list 6 complications of acute renal failure. They said you should what? List 6 complications of acute renal failure. One of the complications of acute renal failure is chronic renal failure, chronic kidney disease. Seriously, when a kidney is acute, like if it's not treated at that acute stage, it's going to lead to what? Chronic stage of that kidney disease. So that is why it is advisable patients with acute renal failure should come for their checkup, go for their dialysis, and ensure that they are okay. That's one of the complications. Then another complication could be cardiac failure, heart failure. Wow. Yes, because once the kidney is having issues, there's a problem. There's going to be a problem with the heart because it will be overworking the heart, and that is going to affect the heart. I don't know if you get now. Then there are other complications associated with acute renal failure. There could be uremia, which is the increased urea in the blood. There could be pulmonary edema, swelling. Remember that as a result of that fluid, they are not going out of the body. There is reduced protein, so the fluid tends to accumulate in the tissues. That can lead to what? Pulmonary edema. There could be metabolic acidosis. That's the acidic. As a result of that uremia, there will not be acidosis in the body. Then also there can be pericarditis. Pericarditis is the inflammation of the outermost layer of the heart. And when there is pericarditis, it can lead to issues with the heart. There can be hypertension as a result of acute renal failure, which is also a complication. There can be hyperkalemia, which is increased potassium in the blood. There can be permanent kidney damage. There can be anemia. Yes, because there's this erythropoietin. It's important. It's being produced around that liver, the kidney. So when there's something wrong with the kidney, production of red blood cells might be diminished. Then there's chest pain, there's muscle weakness, there's fluid retention, there's hypernatremia, there's bone disease, and above all, there is death. So when I'm in the examination hall and they ask me complications, after listing the ones I don't know what to write at the end, I normally put death. Death is always there when it comes to complication. Even malaria can lead to death. So you can take note of these things. Don't forget in this question one we just answered that when they tell you to list, without telling you the amount to list. For example, they tell you they just tell you list the causes, enumerate the causes of renal failure, and they put 4 marks. You are expected to list 8. Here they put 3 marks. You are expected to list 6. In nursing management is 9 marks. I normally advise students to give at least 18 points when it comes to nursing management. Then advice on discharge, I think it was 2 marks. You are expected to give at least 4 advice on discharge. Oh, I know you are waiting for the question too. I actually wanted to shoot this question too today, but seriously, I'm tired after question 1. Alright, the next video you will be expecting is going to be question 2 tomorrow. So if you've not subscribed, all you have to do is to click on the subscribe button, turn on that notification bell so you don't miss out. Immediately I drop the question to you, you will get notified and you will be able to watch it. And also for those that have not registered for our classes on Telegram, you have been missing a lot. Seriously, we have voice notes for cardiovascular, respiratory, all the systems. There are voice notes. We have voice notes for community health, for research, for management, and all you can think of. All you have to do is to send a message to the WhatsApp number showing on your screen. Thank you very much once again for watching our video, and also thank you for subscribing. See you in our next video. Bye.